Okay, newborn assessment. This one's really fun. On our next slide, we have a video presentation of the newborn assessment, and we're going to go through that pretty thoroughly in that video. Okay, so here we have cute Sky. I'm getting her binky so that hopefully she'll be a little bit happier during our assessment. I'm going to start with her head. We always go head to toe, so I'm moving her head from side to side to check her range of motion. While I'm doing this, I'm looking at her eyes and her nose and her mouth. Everything's looking super good, and I'm also looking at her ears to make sure they're symmetrical and in line with each other. And now I'm going to check her head. I'm going to check her fontanelles. There's one in the front, and then also in the back, and I'm checking to see if those fontanelles have closed or if they're closing. And then also if there's, any birth trauma, if her head feels boggy, if she has any bruising or hematomas from the delivery, and her head is just perfectly round and beautiful. She's a couple weeks old, so this is totally normal and what you would expect at this age. So now she's on her tummy, and I'm going to check her back. I'm going to look at her spine and make sure it's nice and straight. I'm also, this whole time, I'm looking at her skin, looking for birthmarks or any trauma that could happen. Now I'm looking at her cute little bum, and in between her bum crack for a sacral dimple. A sacral dimple can indicate a spinal abnormality. It's super rare. Now I'm checking her sucking reflex. She did not want to suck on my glove. I wonder why. She had just nursed, and so I had seen her nurse, and I know that she can suck, so I wasn't too worried about getting her to suck on my finger. I was checking her gums and inside her mouth. I was actually looking for any teeth, which is surprising, but it can happen. Something that I would also do when I'm checking their sucking reflex is plug their nostrils to make sure she can swallow, suck, and breathe. And now I'm checking her range of motion and her arms. I checked her collarbone for any crepitus, that means crunching. If she had broken her collarbone during delivery, then I would feel that. This is the startle reflex. She flared her fingers out, so she's looking good. And now I'm checking her axillary pulses. I just want a good strong pulse. I'm going to check also her femoral pulses. I'm also looking for 10 little fingers, 10 little toes. Now I'm checking for her range of motion in her hips, and I'm feeling her hips at this time to see if there's any hip dysplasia. And I'm stretching out her legs to make sure they're the same length. And now I'm checking the Babinski reflex. You see her toes curl in and then they flare. Something really interesting about this reflex is that if you were to do this on an adult and they had the same response, we would be looking into them for a neurological deficiency. This is a reflex that's only supposed to be in infants. So now I'm checking her vital signs, her heart rate. I'm listening to her lungs to make sure they're clear. I'm counting her respirations. I'm listening to her bowel sounds. I palpated her stomach to make sure it was soft and not distended or hard. Her cord has fallen off, but I would be checking out the cord and checking for 2 arteries and a vein. So right after delivery, what I would be doing is checking those vital signs very first, and then I can assess what that baby needs. So if I needed to bring that baby under a warmer to get a closer look, let's say that the baby's heart rate was low or their respirations were too high, maybe their color was blue or not looking so great, they would probably bring them under the warmer and do some things to help improve their vital signs. And if that didn't work, I would call in the NICU respiratory team to come and further assess that baby. So that's something that you can have in mind after delivery. Like I said, if you want to be able to do that skin to skin and have that uninterrupted time, just request that with your nurse before, and they'll do the best that they can to accommodate you. It doesn't always mean that there's a problem if your baby's being taken away and brought under the warmer. It could just mean that your nurse needs to get a better look at the baby, or they're more comfortable assessing your baby, on a crib or under a warmer, where they have full access to see everything. So that's the end of our newborn assessment. In the next few slides, I'm going to go over in more detail a couple more things that are normal variations on that newborn assessment. I wanted to go over some things that we weren't able to really cover during the newborn video. Just normal variations of how your baby might look after delivery. We kind of talked about this when we talked about skin to skin, that after delivery your baby might not look exactly as you have pictured. So here's just a few things that are normal. One of these normal variations has to do with the shape of the head. So caput. It's the swelling of the scalp in a newborn. It's most often brought on by pressure from the uterus or vaginal wall during a head first or vertex delivery, and it should resolve within a few days. So it's centered. So the way I remember it is caput is like a baseball cap. So it's kind of over their whole scalp, and it can feel boggy, or another word for boggy is squishy. A cephalohematoma is only on one side. It also feels boggy or squishy and should resolve in a few days. So a cephalohematoma is a traumatic subperiosteal hematoma that occurs underneath the skin in the periosteum of the infant's skull bone. Cephalohematoma does not pose any risk to the brain cells, but it causes unnecessary pooling of the blood from damaged blood vessels between the skull and inner layers of the skin. So your healthcare providers will always keep an eye on it, and it will likely just resolve in a few days. Okay, so this is bruising. This is actually my little guy, and it's just another example of possible birth trauma. It's totally normal, and it will resolve itself. Poor little guy, actually, that's not a little bruise. That's a pretty big bruise on his cute little head, and he's got a mullet. Okay, stork bites and Mongolian spots. These are also totally normal findings. Stork bites on the left are a common type of birthmark and are usually temporary. Most stork bites fade by 18 months. This isn't actually my little guy, but he had a stork bite right in between his eyes, similar to this photo, and by the time he was a year old, it had faded. Mongolian spots are really common in any part of the body of dark-skinned babies. They're flat, gray-blue in color, almost looking like a bruise, and can be small or large. They're caused by some pigment that didn't make it to the top layer when the baby's skin was being formed. Mongolian spots are present at birth, and most of them fade, at least somewhat, by age 2. Most have completely disappeared by age 5. If Mongolian spots remain at puberty, they're likely to be permanent. Fewer than 5% of children with Mongolian spots still have any by adulthood. And I would say this picture, on the right of the Mongolian spots is definitely one of the more severe cases that I've seen. Usually it's just in one area, but sometimes it gets all over the back and bum like you see in that photo. And they really can be anywhere. Okay, Vernix. So Vernix is really cool stuff, actually, even though something grosses some people out. It actually protects the infant's skin during pregnancy from the acidic quality of the amniotic fluid. You might be surprised when you see your infant for the first time. They'll likely be bluish in color, and depending on gestation, they may have a generous coating of Vernix or that white cheesy stuff that hides in those adorable folds. Vernix may provide antimicrobial promotion and wound healing, which is why it's recommended to allow it to soak into the skin. However, it can be a catch-22. Since it is made up of mostly water, it can lock moisture in and cause the newborn to have a low temperature. So it's ultimately up to you and your support person whether or not you decide to wait 24 hours to bathe your infant, and you may want to make this decision before you go to the hospital. Most healthcare providers will encourage a bath after 2 successful breastfeeding sessions, which will take place well before the infant is 24 hours old. So as you can see here, Vernix is really cool. It actually protects the infant's skin during pregnancy from the acidic quality of the amniotic fluid, so they don't come out all wrinkly. It's the infant's first blanket. It actually insulates and helps baby maintain proper body temperature in utero, and it does hide in those folds, and it doesn't need to be wiped off. The World Health Organization actually recommends delaying the first bath for 24 hours because of the healing and antibacterial properties of the Vernix. It's also one of those controversial topics everybody has a different opinion on. Most healthcare providers start wiping it off unless you have asked them not to. Okay, so another normal variation to our newborn assessment is this newborn rash or just sensitive skin. Pink pimples or baby acne are sometimes thought to be caused by exposure in the womb to maternal hormones. No treatment is needed, just time. They can last for weeks or even months on a baby's skin. Sometimes certain detergents can cause a similar rash, especially right after delivery. Just think about it. So your baby isn't used to wearing clothes or being wrapped in a blanket, so you can understand why this is a totally normal and common occurrence. Some mothers have actually reported an improvement to newborn rash by applying a small amount of breast milk to the infant's skin daily. So just another one of those great uses and benefits to breast milk. As you can see, it might last for a few weeks to a few months. All right, so here we have another video of the first bath. We wanted to be able to get that to you guys in real time. All right, everyone, so this is baby Mateo, and he is actually only 3 days old in this video. So this is his very first bath. What I'm doing right now is I put some baby oil on the washcloth, and I'm just wiping in those folds, so under the neck, under the armpits, and then as you can see, in those little folds down by his legs. I'm just trying to get off any extra Vernix, and he really doesn't have any anymore because he's 3 days old, and it's kind of all just soaked in. So now I'm going to check the water. You always want to make sure to check the water before every time you use it. We're just going to lather up this washcloth and get washing. So I like to wash my babies from the shoulders down to their feet. We're going to save the face and the hair for very last because we're going to wrap him all up and make sure he's nice and warm because babies can't thermoregulate and they lose most of their heat through their head. So we want to make sure that he's nice and warm for that part. And yes, he's totally screaming. He's not totally in love with the bath yet. So we're just trying to go as quick as we can. Do the front part and then just flip him over, and we're going to get his back and his bum. Just get him all soaped up and clean. And I'm using disposable washcloths. I'll link to them on Amazon, but you can just use, washcloths that you have at home. You obviously don't need a whole pack of disposable washcloths. I got these from the hospital when I had my baby, and they gave me lots of extra. So they were really nice for like spit ups and when I just wanted to like quickly use a cloth and then throw it out. So they can be really convenient, but definitely not something that's necessary. And I'm using the Noodle and Boo baby wash, which I absolutely love. I feel like it is one of the only washes that doesn't dry out their skin, and it smells heavenly. Okay, so I just wanted to point out, notice how I keep checking the water with the underside of my arm. You use the underside of your arm because that's actually more sensitive than your hand would be. And you just want to make sure that the water is warm, not too hot, not too cold, just some nice warm water. But you always want to check it, like I said, before every time you're going to be using the water, before you wash their hair, before you rinse them, etc., etc. Okay, so now we're going to rinse, and I put my arms underneath their shoulders and under their bum, and you just kind of rinse under there. We're going to I'm going to try my best to avoid his cord because it started to dry up. So I wanted to make sure we didn't get his cord wet, but since he hadn't had a good first bath and we wanted to show, we went ahead and did that. When you take them home, after they get their good first bath, you actually don't need to bathe them until that cord falls off. You can just do little spit baths and just kind of wipe them down. So now I'm just drying him off and trying to calm him down because that was traumatic. And we're going to switch out the towel in a minute here and get him all wrapped up and cozy so we can do his face. So with boys, there's really no special considerations. I do want to point out though, well, I take that back. So with boys, you probably are going to get peed on, and even with girls, but boys, it shoots a lot farther. So just kind of keep that in mind. Maybe have a little cloth nearby in case it starts coming, or a diaper that you can just kind of throw on top and catch any of the urine. I can't tell you how many times I've been doing a bath and I've gotten sprayed, but it's easy because I just would put on new scrubs. With girls, do not use any soap on the vagina, only water. And that's just because girls are a lot more sensitive. Their urethra is smaller and they're more susceptible to infection, UTIs, things like that. And same thing, same concept kind of applies to the face. We don't want to use any soap on the face, just warm water. And I'm doing his eyes first, wiping inside to outside, and you see he's got some spit up. So this is actually good that this happened because it's totally something that could happen at home and could maybe stress someone out. So I just sit him right up and start burping him so that he can get his, the spit up out. And it looks like Mom has some really good colostrum. You can see there how yellow that is. So bummer that he's spitting it up. But this actually happens quite frequently too during the bath. As soon as they get clean, they say, oh, I want to be dirty again. So I'm having my trusty assistant give me a bulb syringe chair. I'm going to teach you how to use it. So you want to depress it first and then put it in the side of their cheek and suck out all that extra gunk. Make sure you always depress first, because if you depress the bulb syringe in their mouth, you're just going to be introducing air. So we're just getting out all those bubbles. Sometimes babies are going to be working on that amniotic fluid for a couple days after delivery, and so they've just got, extra spit up. It could be clear or have some breast milk or formula mixed in it. So we're going back to the eyes, and I'm just, showing that you wipe inside to outside, and make sure you use a separate piece of the washcloth for each eye. And then once we finish that, we're just wiping his whole face, making sure we get all those little cracks and crevices and underneath the ears and under his cute little chins. Now I'm going to wrap him up real good so we can do his hair. And this is usually their very favorite part. This is definitely my favorite part to do. And going back to how often you should bathe them. So about every 2 to 3 days, once that cord dries up and falls off, is really all they need. And as far as their head goes, I do recommend that you brush their hair daily and kind of just get that scalp stimulated to help prevent cradle cap. So I just, you can see right there, I just folded his ear over. I do it on the same side. I'm just trying to prevent any water from sneaking into that eardrum. It's okay if a little water gets in there, but we obviously don't want to be, letting the stream run right in there. So again, this is the Noodle and Boo wash, which I love, and I've got the Noodle and Boo lotion as well. And that's just a hospital scrub brush. It's a soft bristle brush, and I'm just making sure that I'm getting it all soapy and getting out any of the things from birth that could be left in that hair. So any blood clots or whatever that could be in there. And if the hospital sends you home with one, or if they leave one in the crib, go ahead and feel free to take that home and use it. But you can also just use a soft bristle brush that can be found at any store. And I'll make sure that we have links to all this stuff so you can make sure you're all stocked up for your bath supplies. Yeah, I think he's finally starting to like his bath. He was giving me some crusties there. Yeah, there's the crusty. Come on, guys, just let me go to sleep. All right, there's the stuff. Here's the day at the spa. We're just gonna rinse all that soap out, make sure we get the back of the head. And I like to hold them, as you can see, just kind of like a little football under one arm. Just making sure I support the head and the neck with my hand really well. And we're done. So we're going to dry off his hair. Remember earlier how I mentioned that newborns don't thermoregulate and they lose most of their heat from their head. So we're going to make sure we get that hair nice and dry so that it doesn't make him colder. Often in the hospital, they ask that you allow the baby to be kept under a warmer for a few minutes after the bath. That's because it kind of just freezes them out, and we want to make sure that they're nice and warm before we send them back to the hospital room. Oh, all clean. So sweet. There's Mama in the background. And we're done.